Vasculitis, as the name indicates, there is inflammation of the blood vessels. Okay. We classify the vasculitis according to the size of vessel involvement. So we can classify into three groups: large vessel vasculitis, medium vessel vasculitis, and a small vessel vasculitis. Okay, so this is the classification of vasculitis. Then there are causes of vasculitis. It could be primary vasculitis, it could be secondary vasculitis. Okay, so I will give you the causes of vasculitis now. Primary vasculitis, like we have granulomatosis with polyangiitis. Old name is vaginous granulomatosis. The second one under primary vasculitis is microscopic polyangiitis. And the third one is eosinophilic granulomatosis with polyangiitis. These are primary vasculitis causes. Secondary vasculitis can occur in SLE, rheumatoid arthritis, or can be secondary to some infection like hepatitis B or C. And sometimes vasculitis occurs due to drugs also. So we will say drug-induced vasculitis, and sometimes vasculitis is associated with some malignancies and cryoglobulinemia also. So this is how we can find out the causes of vasculitis. Okay, because vessels are present everywhere in our body. Okay, and there is inflammation in the blood vessels. Whenever there is inflammation, so the patient develops the B symptoms. Examiner may ask you why the patient is having B symptoms. The B symptoms occur because the patient is having vasculitis everywhere in the body. So what are the B symptoms? There are 6 B symptoms that we should ask to the patient. Patient will be having fever. It will be low-grade fever most likely. Low-grade fever, 1 B symptom. The second one is malaise and fatigue, 3. Then myalgia and arthralgia, 5. And then weight loss and loss of appetite, 7. So these are the 7 B symptoms present in cases of vasculitis. All 7 may not be present. The patient may not report all 7. Patient may tell you some of them or many of them. So it is not necessary that all 7 should be present. So patient may report to you low-grade fever, feeling malaise, fatigue, tiredness, myalgia, arthralgia, weight loss, and loss of appetite. So these are the B symptoms in patients with vasculitis. Okay, so according to the size of the blood vessels involved, we have to remember some 2 or 3 diseases from each class. So we will not miss our cases because these are the cases coming in our clinical practice also very commonly and in the exam also. Large vessel vasculitis, we can remember like the giant cell and temporal arteritis, and the second one is ANCA-associated. Okay, so these are the 2 large blood vessel vasculitis we should remember. Large vessels means it will involve the aorta and its main branches. Aorta and its main branches. Okay, the main branches like subclavian vein, brachial vein, arteries, subclavian artery, brachial artery, carotid artery, renal artery, femoral artery. So these are the main branches of aorta that will be involved in large vessels vasculitis. In all of these main branches, we will focus mainly on giant cell arteritis and arteritis. Giant cell arteritis, just now we discussed the case. The giant cell arteritis, they have a special tendency to involve the temporal artery or the cranial arteries or the arteries that is supplying to the eyes or to the arteries supplying to the jaw or the tongue. So the patient can have like tongue claudication, patient can have jaw claudication, the patient can have visual problem, the patient can have temporal headache. Okay, so giant cell arteritis, they have the special tendency for temporal arteries, but they can affect any of the large arteries. Okay, while the Takayasu arteritis, usually the patient present with unilateral limb pain involvement or the limb claudication. They can involve like subclavian artery, they can involve femoral artery, they can involve the artery supplying to the legs. So these are the arteries that will be affected in Takayasu arteritis. Going back to giant cell arteritis, patient can present with jaw claudication plus B features, B symptoms of vasculitis. Giant cell arteritis can present with blurring of vision, loss of vision, transient loss of vision, can present with TIA-like features, can present with like a stroke. Okay, that's supplying to the cranial arteries also. If it is affecting only to the temporal artery, patient will be having features of temporal arteritis. And because temporal artery, the next branch is going to the eye also. So there will be visual loss and visual impairment will be there, and this visual loss can become permanent. In temporal arteritis, patient will be having patchy swelling of the blood vessels. Okay. Another important thing in the investigation point of view of all vasculitis is if they ask you what is a gold standard test to diagnose vasculitis. So the gold standard test is biopsy. Okay, we should take the biopsy. But when we have the large vessel vasculitis, we cannot take the biopsy. Like if the aorta is involved, or subclavian vein is involved, or carotid artery is involved, or femoral artery is involved, we cannot take the biopsy. In the large vessels, we cannot take the biopsy. So there is alternate investigation, that is MRA and CTA. These are helpful in the diagnosis. So remember, in large cell vasculitis, large vessel vasculitis, we will say the CTA and MRA, except for in giant cell arteritis affecting the temporal artery, we can take the biopsy from temporal artery. Okay, so these are the points about the giant cell arteritis. Just to highlight some points about the Takayasu arteritis, there will be unilateral limb pain in such patient. Limb claudication will occur when the patient is doing some activities, and whenever there is interruption in the blood supply, patient will have the pain or the claudication. Once the patient is going into rest, this condition will improve. If it is involving the legs arteries supplying from the femoral artery, if it is affected, then the patient will be having leg claudication. In this also there could be patchy swelling of vessels involvement. Whenever there is patchy swelling, biopsy can miss the findings. Okay, so if the affected part is taken in the biopsy, you can pick up the finding. But if the affected part of the biopsy is from the biopsy, if the affected part is not taken, we can miss the diagnosis. So this is the condition in all of the large blood vessel vasculitis. So what we will do, we can do the CTA and MRA. Also, the large vasculitis can occur in renal artery, brachial artery, radial artery. So the presentation will be different according to the involvement of the arteries. And the part supplied by the artery will have the clinical features of claudication, pain. There may be coldness of that area, feeling cold. Okay. During the period of vasculitis or claudication, patient can have weakness of that area also. during the period of attack, you can say in simple words, patient can have the weakness. Whenever the attack is subsided or the patient is resting, so this weakness will disappear. But this is an alarming sign. It can deteriorate anytime and the patient can develop permanent weakness of such part anytime. Very important while we are doing the examination of vasculitis patient, we have to listen the bruit in affected areas. Whatever the affected area is suspected, we should listen the bruit over there. Okay. So carotid artery bruit we have to check. Like in giant cell arteritis, we must check the carotid artery. Subclavian area we should auscultate. Femoral artery area we should auscultate. Kidney bruit we should auscultate. These are the points, these are the areas where we have to auscultate. And before this, in vasculitis cases, we should do all the pulse examination. All the pulses should be examined and compared with the other side. Like radial pulse is checked on one side, radial pulse should be checked on the other hand also. Radial comparison, radiofemoral comparison, femoral comparison should be done. And another important point is, if there is vasculitis of the legs or the arms is suspected, we should check the blood pressure in all 4 limbs. So these are the 3 important points during the examination. We should listen the bruit. We should do the full pulse examination in vasculitis cases, and we should tell to the examiner, or to practically we should think about that we should check the blood pressure in all 4 limbs. Whenever the main branch of abdominal aorta having the vasculitis, patient can present with hypertension and can present with features of like weakness in the lower part of the body. So we will do the all pulses examination. We will find out that there are weak pulses in the lower area, good pulses in the upper area. This will indicate. Okay. So then we will auscultate the bruit in femoral area, renal area, also carotid subclavian area. So this is all about the large vessels vasculitis. Now I'm moving towards the medium vessels vasculitis. For medium vessels vasculitis, where they are present, there is mnemonic CANT, C-A-N-T. Write in the chat. C-A-N-T. And S also, CANTs, you can say. Okay. So these medium vessels are present in coronary arteries, C for coronary arteries. They are present, A for abdominal area, N for supplying to the nerves, T for testicles, S for skin. Okay. So these are the areas where the medium vessels are present. Skin is the biggest organ of the body. Skin having all the types of blood channels or blood vessels. Large vessels also supplying to the skin, medium vessels and small vessels also. Mostly it is medium vessels and the small vessels are supplying. Similarly, the kidney is a specific area where we can see the large vessels at the entry. Okay, at the entry there is large vessels. Then at the area of callaceal system, pelvis of the kidneys, there is medium vessel vasculitis, and then in the cortex area there is small vessels. So medium vessel vasculitis, remember that term or the mnemonic is CANTS. It is supplying to the coronary arteries, abdominal arteries, supplying to the nerves of the bodies, supplying to the testicles, supplying to the skin. Okay. In medium vessel vasculitis, we have to remember 2 diseases only. Number 1 is polyarteritis nodosa, and number 2 is Kawasaki's arteritis. Out of these 2, Kawasaki's is appearing in the kids, not coming in cases examination. So Just to you can ignore it, or you just remember that Kawasaki's arteritis is occurring in the kids, and the spatial tendency they have got for coronary arteries. They are affecting the coronary arteries. Going to the polyarteritis nodosa, it is supplying mainly to the abdomen, the mesenteric artery. The patient will be presenting with abdominal pain after taking food, after few, like 30 minutes to 1 hour after taking, or 2 hours, 1 to 2 hours after taking the meal. Patient is having ischemic type of pain. Okay. There is association in polyarteritis nodosa with hepatitis B. 30% of the cases of polyarteritis nodosa, patient will be having the hepatitis B also positive. So this is indicate that if you will take the past history, patient will be telling you that I'm having hepatitis B also. So your mind should immediately go towards the polyarteritis nodosa, together with the features of abdominal pain that is coming after taking the meal. So mesenteric artery, we can take the biopsy. Biopsy can be taken. Medium vessels in the small vessel vasculitis, we can take the biopsy. But non-invasive test is available, that is CTA and MRI. So this is briefly about the medium vessel vasculitis, and the treatment is immunosuppressant. For all vasculitis, the treatment is immunosuppressant treatment. We will do the investigation and the management of each cases when we will do the cases one by one, like we have done now. Giant cell arteritis investigation and management. Medium vessel vasculitis also having involving the nerves. The patient will be having features of peripheral neuropathy if multiple nerves are involved. If the medium vessel is involving only one nerve, so patient can have features of mononeuritis, multiplex. If the medium vessel vasculitis affecting the skin, so patient will be having the skin rash. Supplying to the blood channels going to the joint, patient will be having arthralgia. Supplying to the testicles, patient will be having the testicular pain. So whatever the blood vessels are involved, patient will be having the features of that. So this is all about the medium vessel vasculitis. Now I'm going to small vessel vasculitis. Small vessel vasculitis, you can have a mnemonic skill N S K I L N. Okay. S for skin, K for kidney. Okay. I is nothing. L is lungs, and N for nerves. So these are the area where the small vessels and the capillaries are present. If they are involved, the patient will be having a small vessels vasculitis. Here also, we have to remember some diseases that are specific to remember. We can divide into two groups: ANCA-positive small vessel vasculitis and ANCA-negative small vessel vasculitis. ANCA-positive include like granulomatosis with polyangiitis. The second one is eosinophilic granulomatosis with polyangiitis. And the third one is microscopic polyangiitis. These three only. Just remember these three. Okay. And you can include also rapidly progressive granulocytitis or good foster syndrome also in it. So these 4 or 5 diseases, we should do it very clearly. We should have the idea about this for our exam point of view. Then ANCA negative vasculitis. Again, 3 diseases we should remember. Behçet's disease, number 1. Number 2, cryoglobulinemia associated vasculitis. And number 3 is HSP, IgA nephropathy. So these are the small vessel vasculitis that you should remember. Okay, so we can do one by one according to our cases. This is all about the approach of vasculitis. Just to highlight how to take the history and what question we will ask and what investigation we should do. Briefly, I will do. Then we will proceed from here. General question you will ask about the low-grade fever or the fever, malaise, fatigue, myalgia, arthralgia, loss of weight and loss of appetite. Then organ-specific question you will ask the patient. Follow the Jervales. You will not miss anything. So here, like S for skin, Jervales. Last S is for skin also. Skin rash. Do you have any rash? Or the Jervales R for rash. Any ulcer, purpura, or any livedo reticularis type of rash. There are different types of presentation in the skin rash. So whenever there is rash, we will ask the patient, show me the rash, where is the rash, and then we will proceed. Okay. J for joints. Do you have any joint pain? Yes. So which joint is involved? Yes. See the joint, which joint is involved. Is there any swelling or no? If there is no swelling, it is arthralgia, not arthritis. If there is swelling, then you have to differentiate whether it is mechanical type of pain or inflammatory type of pain. Okay, then waterworth, the renal involvement we have to ask about. We have to ask the patient, did you notice any change in the waterworth color, amount, any tardiness is there or no for proteinuria, amount to decrease to find out whether there is decrease urine output is there or not. Okay, then the respiratory, you can ask for cough, hemoptysis, and shortness of breath. In the GI, you can ask abdominal pain, blood per rectum, or the melena is there or no. The neurological also important in vasculitis, so headache, visual changes, and the peripheral neuropathy, and just like the mononeuritis, multiplex features also. Sometimes this patient can present with stroke-like symptoms also, the weakness of the arms and the legs with other features, so we have to rule out the stroke-like strokes also. Right. One question is arising, why the patient of vasculitis having the high blood pressure? Most of the cases with vasculitis, you will see that blood pressure is high. Why the blood pressure is high? It occurs because the blood vessels, they are elastic structure, blood vessels. So whenever there is vasculitis, they will lose their elasticity. So they lose the elasticity, so the peripheral vascular resistance increases. As a result of this, patient develops the high blood pressure. And there is decreased blood flow also to the distal area. Whenever there is the vascular resistance in one part of the body, distal to that area, the blood is not going. As a result of this, the heart has to pump with high pressures. Okay. Another point is decrease blood flow going to the kidney also, so it will increase the renin angiotensin system activation. So whenever this renin angiotensin system is activated, the blood pressure will increase. So these are the points in the history that we have to focus. In the past medical history, we should ask the patient about these problems. Like the previous episode, do you have like this or no? Any autoimmune disease patient is having or no? Any infection is there or no? Any malignancy is there or no? To rule out the secondary causes of vasculitis. The drugs that can lead to vasculitis, like hydralazine and propylthiouracil. Family history of vasculitis is very important. Similar condition is running in the family or no? You can ask like this. Social history is very important. Do you smoke? So you have to stop smoking, very important. And in cancer arteritis, you have to stop driving also. Travel history we have to take to rule out infectious causes of vasculitis. Okay. Briefly, just highlighting the examination of vasculitis case. So you would like to check the blood pressure of the patient. You would like to check the body weight of the patient. You would like to check the patient is emaciated or no. You will check the rashes over the skin. Okay, whether it is palpable or no, it is purpuric or no, any ulceration is there or no, tenderness is there or no. So these all things you will see in the exam. In the eyes, you will try to find out scleritis is there, episcleritis is there or no. In neurological examination, you should check for focal neurological deficit, peripheral neuropathy. In the eye examination, you will check the visual acuity, visual field, edge movement for the eyeball movement, and then fundoscopy you will offer. In cardiovascular system, very important to check all the pulses, blood pressure in all the limbs in some cases, and we have to listen the drills. In chest examination, we have to see any findings going in favor of cavity formation or fibrosis. In abdominal examination, we have to check for organomegaly is there or no, and we have to check for tenderness due to mesenteric ischemia is there or no. Musculoskeletal system is important. Patient is telling myalgia, arthralgia, you have to do the examination of the joint, which joint is affected, whether there is swelling is there or no, muscle tenderness is there or not. Kidney, we have to ask the question for renal impairment, we have to check for blood pressure, we have to check for pedal edema, we have to check for renal druid. How to investigate these patients? Baseline investigation very important here. CBC, ESR, CRP, often they are high because it is inflammatory conditions. Inflammatory markers will be high. Autoantibodies, ANA, we can do ANA into DNA into Smith if we are suspecting the secondary causes of vasculitis. Otherwise, ANCA panel is important. C-ANCA and P-ANCA. C-ANCA is positive in glomerulonephritis with polyangiitis, and P-ANCA is positive in eosinophilic with polyangiitis and also positive in microscopic polyangiitis. Other antibodies like anti-nuclear antibody and R effector could also be considered. Renal function is very important to assess for two reasons. Number one is for renal involvement, and the number second is we are going to start some immunosuppressant that will affect the kidney functions. Urine analysis is very important to check for hematuria, proteinuria. Liver functions also important to know this involvement is there or no, and we will give some medicine that can affect the liver functions. CBC important to check for anemia associated, leukocytosis associated, thrombocytopenia. If lung involvement is there, we will do the chest X-ray, CT scan. Okay. If cardiac involvement is suspected, ECG, echocardiography. If kidney involvement other than the kidney functions, we can do the ultrasound, AUV, and we can go for kidney biopsy. Similarly, for lungs involvement, we can do transplant biopsy. Okay, so these are all about the investigation. The most important investigation for arterial involvement will be CTA and MRA, and the gold standard test is biopsy, if you can take the biopsy from the affected area. Most of the treatment starts with immunosuppressant, and if it is secondary vasculitis, we have to treat the cause of secondary vasculitis. This is all about approach of vasculitis.
For more detailed explanations and related topics, we invite you to watch our videos on our YouTube channel. Don't forget to like, comment, and subscribe to stay updated with our latest educational content. Thank you.